Welcome back, everybody. In today's video, we're going to talk about the mighty NHS, or National Health Service. Here in the UK, that is our publicly funded National Health Service, which is funded primarily through taxes, and something we've not talked about, thankfully, because we've not had to use it. However, to my left, Annie has just recently had her first NHS experience as an American, so we are here to talk about our experience.
Definitely. And in case you're new here, I'm Annie and this is Zach. And just over a year ago, we moved from California to Scotland. So this is one of those topics that everyone keeps mentioning to us. Like, when are you going to talk about the NHS? Well, today is the day. So let's get into that. But let's preface this with saying that everyone's experience is going to be slightly different. We are in a smaller town outside of Edinburgh. And of course, the services we receive are going to be different than someone based in London or in Wales. So yeah, let us know in the comments if what we're saying rings true to where you are for the British audience. And yeah, we're also going to show our perspectives with the background knowledge we have of the US system and sort of compare and contrast a bit.
Yeah, we've heard great stories about the NHS and not so great stories about the NHS, so here's our experience. First things first, though. As an American, how do you have access to our wonderful NHS?
Yes. So you might think that I just come here and scam your system and get free healthcare. No. That is not the case. Not only do I pay into taxes, all the same British taxes that everyone else pays here, in order for me to actually legally reside in the US or in the UK, I had to obtain a family visa and a spouse visa, also known as, I should say. And with that, I pay yearly about a little over £1,000 per year. And I have to keep doing that until I become a citizen in about 5 years.
And that's just so she can use the NHS.
Yes.
The visa itself cost is additional to that.
Luckily, Zach is a citizen, so he gets to benefit from just the taxes, and our children are citizens as well. So I'm the only one who has to do this in our family, but it also gives us insight into how everything works on a different level.
Okay, so first caveat, Annie is healthy. She's not got any life-threatening illness, thank goodness. But we are going to go through her experience. So, signing up, getting joined to a practice. Do you want to start there briefly?
Yeah, so it's very similar to how you sign up for services in the US. You usually have a primary care physician. Here they're called your GPs. Is that general practitioner?
Yep.
Is that okay? And it's your just standard doctor's office, and then you sign up by old dinosaur means of only filling out paperwork forms and then submitting them. I think there was a form or two that you had to do online.
But yeah, online, but then when you're online, you're just filling in like Word documents. So it's that thing when you type and then the line keeps moving, and it's obviously the technology side of things has not been taken care of too well.
No.
But like I said, similar to America, because some of those forms are terrible.
Exactly.
And you're filling out the same information like 4 times for the 4 different forms. So that side of things, almost identical. But yeah, we really didn't have a problem signing up.
No, so signing up was pretty seamless. We didn't even have to prove our address, which I thought was interesting. I would say US-based healthcare, you definitely have to show up with your insurance card. You have to have your form of ID. I don't think they asked to see my ID the first time. No, they didn't. So it's just interesting. There's a lot more trust here.
Yeah, even the carry through, like I said, you just give your name and date of birth, and then they'll look you up, and if there's a match, that's you. There's no there's not really a system to defraud. So
exactly,
and that makes that part of things a lot easier.
So the signing up process, pretty seamless. What does that bring us to? Actually, scheduling. Yeah.
This is something we'd heard a few horror stories of. Like, oh, I can't get an appointment for 2 months, or this, that, and the other. The only experience we've had before this was with our kids, and we got some great advice from the comments. Call up Monday morning, 8 a.m. when the office opens, and especially with kids, they'll do a really good job of trying to get you in super early.
Yes.
And our middle child had an ear infection, and he was able to get in same day to see a nurse and got that all taken care of. With adults with non-life-threatening Conditions, it can vary between a week, 2 weeks, like I said, depending on where you are. But how was your scheduling experience?
So for me, I called up midday on a Monday, I think, and ended up getting an appointment Wednesday.
At like 1 in the afternoon?
Yes.
Yeah.
And for them, they did want to assess the urgency. So I was asking about getting an inhaler because I have asthma and I've just been wheezing a bit when I'm exercising. And so they wanted to make sure I wasn't wheezing at different times of the day. And they went through a battery of questions. So that's just
the lady on the phone?
Yes.
Which is another difference because in America, I don't think you'd get that. You would just make an appointment.
Probably.
And like there might be like a little line like, oh, if this is an emergency, call 911 or whatever.
I think that's what she was trying to assess, whether or not this was something that needed imminent attention or if it could wait until they had the appointment on the Wednesday.
I have a sore toe. Okay, we'll see you in 3 months.
Exactly. So after getting my information and going through that, I got an appointment on Wednesday. Once again, super easy. And we'll go into the appointment now, I guess.
Yeah. My big gripe in the US was you have your appointment, that's all great, you turn up, and then you just sit there and wait.
Oh, this is the worst part. The waiting in the US is...
All right, so if we just randomly move spots, it's because these two dumbos with the camera have been talking to a dead camera for the past 10 minutes. The battery ran out and we didn't realize, so we're back.
Round 2. Actually, I think this is our third round filming this one. Anyways... So I think we were just talking about the wait times in the US versus the UK.
So you get into past the first round of waiting and you're in this room with the assistant or nurse and they ask you questions and might do a couple of little tests. And then they say, okay, and the doctor will be with you shortly. And maybe 10 to 30 minutes later, you might get to see the doctor or
it's awful.
RN. Yeah.
It is the most draining experience. It's like sitting in the DMV, just... waiting, pointless waiting, and it's awful. But in the UK, so different. I'm really glad to report that I checked in, was sent to a waiting room, and within 5 minutes, I was seen by the actual providing, so the nurse in my case.
Yeah, so the person that came and called your name was the person that then actually conducted your appointment.
Exactly.
A miraculous invention. I had the same experience when I took our son. Yeah, maybe 5-10 minute wait time. And again, it was the same person who called me that took me then in. And again, that could be because we were in a smaller doctor's office.
Yeah.
But that one gets a 2 thumbs up for
let us know.
Efficiency, especially when we're trying to schedule children and life and all that sort of stuff. So.
And then following that is the actual care you receive in the appointment. So I was there talking about an inhaler. My hay fever has been getting the best of me, and I just wanted to make sure that if worst came to worst, I had an inhaler for my asthma. And
asthma, which Annie has tried so hard to mentally remove from her body.
It's just not working. I try every year, and it keeps coming back.
She usually needs her inhaler like once a year, to be fair, so yeah.
But the nurse was so wonderful. She was quite enlightening and also in a non-condescending way informed me that childhood-induced, or what is it called?
Exercise-induced asthma?
Exercise-induced asthma, typically diagnosed as a child, isn't so much a thing anymore. And they're finding out that a lot of those people don't actually have asthma and they were misdiagnosed early on.
So it's been so long since you've been to the doctor that medicine has changed. Science has progressed.
So she informed me of this, did still go through all of my symptoms, prescribed me an inhaler as a just in case, we want to make sure that you're not left stranded. But then she also went ahead and referred me to a specialist, which she does through her computer system all on her time, and then informed me that in shortly I would receive a letter from the Royal Infirmary in Edinburgh, a big hospital, and they would book me an appointment to do all the asthma testing, these battery of tests that will give me a definitive answer. So
yes. So literally mail through the letterbox, like a snail mail letter, which was the same experience we had with our son when he was referred to a specialist. The mail did come within a couple of days, but then you just get given your appointment time. And because you're not sure how long out the next appointment is, you just kind of take it and make that work. That means you might have to take some time off work or out of school, which I would say is a big difference to the US. There's definitely more choice. especially with specialists, once you get the referral to a specialist in the US, you basically then go back to your healthcare provider and you have this sometimes long list of people you're able to go to. And then it's up to you to decide who you like the most or who has the best availability. Whereas here it's like, this is the service we offer. This is the time we can go.
And
do you want to?
You're welcome in 3 months.
Do you want to, or do you want to wait even longer? So you've not got that yet, so you can't say how long it's going to be out.
She told me somewhere in the range of 2 to 3 months is when I can expect to get an appointment.
Which then makes sense why she was so thorough to make sure that you would survive those 2 to 3 months without needing any other care. So,
and I do have to say that the level of care provided was top notch. The patient education was amazing. Just how much she walked through every single symptom and felt like it wasn't rushed in the slightest. And although I do feel we received excellent care in the US, sometimes it felt that you needed to be out of there, like they needed to get to the next appointment.
People,
exactly.
Yeah, in the US it was mainly the kids we took them in for, and thankfully again it was minor things, earaches, this, that, and the other. But yeah, you could sometimes hear the doctor dealing with the person next door, and then like the door would close, and then you get a knock on your door would open, and
you can hear him making the rounds.
He or she goes into the next one, and there probably is that in other areas here, but our little doctor's office just I had the same experience when I took our son. Just sat us down, explained everything. There was no rush. Asked us if we had any questions, and just it was kind of more like going to see like a nurse at school, than like a
the bedside manner was top notch. Loved it.
Annie's a big one for bedside manner. She likes to be just likes a kind presenting person to talk to her. And
so that brings us to aftercare. Things like prescriptions. How does that work? And do you want to go into that?
Yeah. So the prescription thing, the background workings of it, we're a little confused about, just because the way our area runs, sometimes a prescription can get from our doctor to our chemist within like 2 days. Sometimes it takes 4 or 5 days. So you'll put your prescription in, especially for a repeat prescription, you'll put it in and then go like a few days later and ask for it, and they're like, oh, we just got that today, like we need some more time. So that sort of thing, I'm not sure if they wait until they've got a certain number of prescriptions to send them over, or it could be they physically use paper and it's like put it in a bag and you walk it across. Because if you choose to take your prescription yourself, they will just give you a physical piece of paper, and you can hand that into your chemist. And then if they have the item in their storeroom, they'll usually need about 30 minutes to prepare it for you, and then it's yours. So it's very straightforward. And the best thing, I think, is if that chemist does not have what you need, you can simply take it next door to another chemist, hand them the prescription. If they have it, they'll issue it to you. There's no like signing up with a chemist. It's just everybody gives prescriptions for the NHS. So you can go to any chemist in your town or city and get what you need.
It's nice because in the States, although you are able to go to a CVS or a Walgreens, different entities, once you've sort of selected who you want your doctor to send your prescription to, you have to wait for them to get it. Then if they don't have it, then you have to see if one of their other chain stores has it. If they don't have it, then you have to go back to your doctor, have the doctor send it to a different set of stores. It's just a terrible process. It takes so long.
All of them need to then run it through your insurance company as well.
Yes, everyone.
Which can be the biggest hurdle actually for them to deal with and for you to deal with. And if you phone them up, there'll often be an option like, are you a provider or are you a customer?
Right.
And we've had no end of issues in the US just trying to get simple prescriptions that were maybe out of stock one place.
Yep.
And it just...
And then you'll call your insurance and they say, oh no, that's already been handed off to this. They're filling it. We can't until they call us back and tell us that they took it off the shelf.
Or they ticked the wrong button and it looks like they prescribed it to you. Exactly. So then you're like, you can wait a month. You're like, no. Anyway, so there's none of that. And the best part of it, in Scotland, the amount of money you hand over at the point of service is $0.99,
yes,
which is phenomenal. Now, unfortunately, that's not the same throughout the whole of the UK. We had that as comments on another video. People in England have to pay, I think it's like £9
I think so.
per prescription. So let us know in the comments what that number is, and if it's different in Wales, Northern Ireland, all those places, or if it's even different throughout England. I'm not sure.
And then comparatively, from the US point of view, if you have good medical insurance, which is typically through your employer, you can pay to do it outside of your employer if need be, but that's usually more expensive. The prescriptions that we found were about $5 per bottle of the same meds that we get over here. So we didn't have to pay a lot for prescriptions in the US, but so many families don't have the same kind of coverage, and it's ridiculously expensive.
Yeah, that same medicine that we're handing over $5 for, someone else might have to hand over $50 or $100, and then it becomes a sort of decision of,
do I need this?
Can I afford this? And how bad is it? And we're not going to go too deep into all the numbers of that, but like Annie said, if you don't have insurance through your employer, at least in California, there was like a health insurance marketplace you could go to, or you had to go to get health coverage, which could be $500, $800, up to $1,000 a month or more. And if you think, well, I'm healthy, I don't need health insurance. No. When it comes time to fill out your taxes, you need to provide the IRS with proof that you had health coverage throughout the year. Otherwise, they fine you.
Yes.
The last time I heard the number, I think it was like $5,000 plus for the fine, which sounds like a lot and is a lot, but is cheaper for a lot of people than if they actually paid monthly for their health cover. So, complete gamble. Because if you did need to go to the hospital or anything, you just have to pay the full ticket price.
Awful.
And both of us have had to take ambulance rides, and they were north of $5,000 for short 5-minute ambulance rides. So with our insurance, we'd have to pay maybe a few $100s for that. And then after our family collectively in the year spends like $5,000, things are free at point of service. But yeah, if you don't have health insurance, you're paying you have to come up with $5,000 for that.
Those children are wrestling in there. Gotta reel them in.
It's knuckle dusting time. Okay, false alarm. It was a positive experience. Our youngest is toilet training, and that was happening. So it was a success, though. So we're back. The last thing I want to say about our Chemist, I think I've already mentioned how wonderful and friendly and stuff they are when you go in. Even when things have gone wrong that are not their fault, they're just lovely, sweet people there. Other thing, if you go to the doctor's office, there'll be a poster that will tell you if you're experiencing, and there's a long list of symptoms or problems, you do not need a doctor's appointment, and you can skip that whole process and go straight to your chemist and get creams for rashes or medicine for earaches, or
an inhaler.
And an inhaler.
I didn't realize that.
Yeah, I wonder, you probably could have gone for your hay fever.
I think so.
Extreme hay fever medication, that sort of stuff. So it's just a wonderful service to have, and yeah, we're really lucky with the chemist that we use. So yeah.
So overwhelmingly, this has been so positive. We appreciate the pricing. That's the biggest perk. And we appreciate that it's universal healthcare to all, and I feel like that should be a right to all humans. So I appreciate paying into that system.
We were truly in a very fortunate position with the Highway Patrol providing the health coverage it did. And that's just not the case for so many people in America. And yeah, it's like if you're having a hard time money-wise, like it's a financial drain. But then you have absolutely no money. Those people sometimes get health services for free. So it's a really tricky situation.
Feels like if you're in the middle, it's the hardest.
Yes, yeah. So anyway, moving on from that.
There was one thing I wanted to talk about as far as differences with appointments that I forgot to mention. And that is over here, after they send you your letter to book your appointment, sometimes that's just a phone call. And that's something that really I never had in the U.S. unless a doctor was calling.
Versus like a video call? Or?
Yeah. In the U.S., they only ever did a phone call to tell me a lab result. Like, just wanted you not to worry over the weekend.
Yeah.
This was clear, and that's that. Here, you can have a full appointment just on a phone call, whereas in the States, think if you want to do that, they have to see you. It has to be
Yeah,
virtual.
and I don't know if that is partly to do with like having to confirm who you are.
Possibly,
because so there's not any there's no way to sort of defraud the NHS because it's available to everybody. Whereas in the US, obviously, if you pretend to be someone to get better services, that's an issue.
Yeah.
Yeah, or maybe, yeah, I don't know. The legal side of things in the US might
Possibly.
Who knows?
Just one small difference.
It's
so.
very convenient though, because with how busy we are, just being able to pick up the phone and not have to do a video or go in person or whatever makes things a lot easier.
It does.
Yeah.
It sounded like you were about to say something before I sort of cut you off there.
I think I was just about to say the same thing actually, and go into that point. So, all right. So, like I said, we've been very fortunate. Even Annie's recent experience was not a major interaction with the NHS. So hopefully we never have to make one of those videos.
Yes.
But we have heard wonderful stories, and we've been aware of not so wonderful experiences with the NHS, and it seems to be location specific, and sadly also specific to like the patient's age sometimes.
Patient's age and sort of the level of intervention required. So if it's something extremely severe or an acute ailment, they'll need to get you in right away. And
but sometimes if you have like
a broken arm,
a broken arm that needs
physio,
the physio might still be like a month or two out, and that's just not practical. So,
yes.
I think that pretty much sums up our experience with the NHS so far. It's been 99% positive from our view. For all the reasons we've mentioned so far, it exceeds our experience in the US, I'd say, with the exception of like the convenience or choice you have in the US.
Let us know, though. I definitely agree with that. So we feel very thankful for it, and let us know if your experiences differ from ours. And
one last thing, because I have to address this and this. This guy underestimated the wonderful Scottish weather we've been having recently. We went to Haddington to Goat Fest, which is an outdoor music festival / beer festival, cashing in some of those rounds of beers.
Yes, thank you for those.
Very
for all the kind words.
Nice people have been sending us. And who would have known that a couple hours in direct sunshine would give me this plastic Ken doll forehead?
I was laughing because I could see it changing minute by minute. He came, show him your watch tan.
Oh, yeah.
Okay, he started off as this color.
Turned
into this color.
I always have my watch on, so this is definitely extreme, but I usually, much to Annie's annoyance, I tan very easily.
Yes.
And don't burn very easily, so I was like,
I was watching him like a rotisserie chicken.
I wasn't spinning. But should have worn a hat or something, a little sunscreen, but it was it was a fun day though.
It was a great time.
Some old music and covers, and Haddington's a cute little town, and it was just in a field with some guess what? Scottish people do own folding chairs.
Everyone there had their folding chairs out, and it was a sight to see.
Yeah, we mentioned in another video about watching sport. Nobody had them, but I guess they have them, and they only bring them out in the summer.
They have them for Beer Fest.
Beer Fest. Good for you, Scotland.
All right, take care, everyone. Thanks so much again for tuning in.
Bye-bye.
Bye.